experts are warning of the dangers of buying prescription drugs from online pharmacies. These are regulated websites where customers can buy prescription-only drugs by simply filling out a questionnaire before it's checked by a pharmacist or doctors. But critics say the checks are not robust enough, and talkTV found that some sites don't actually share information with GPs. Well, joining me live is Pharmacist Thorrun Govind. Thank you so much for talking to us on talkTV this afternoon. What's your reaction to these findings?
It's concerning. I think we need to recognise that people are increasingly seeking convenience by going online, but medicines are highly regulated items. They're not. It's not your bread and butter that you're going to buy at your supermarket. These are, these are medications which we the right person at the right time in the right dose.
So just explain to me, Thorrun, how these websites are supposed to work. Are you meant to fill in a form, say, yes, I need this prescription, or I need this medication, rather, and upload a prescription, but then I'm assuming that a human pharmacist, rather than a computer, says, yes, you can have that, yes, that's a genuine prescription. Is that how it's meant to work?
Okay, so it is very confusing if you've not actually had a go yourself. So just as a look at the other side, if you walk into a pharmacy straight away, you'll see a member of staff or you'll see the pharmacist. You might not get to speak to them immediately, but they are there in front of you. If you as a patient go onto a website, what our concern is that there is a variety, there's too much variety as to how these interactions are happening. So for some people, they will fill in a questionnaire and then they will have a consultation and it will go through that sort of flow of route. But for some people, they have been able to, on minor occasions, but still a concern, they've been able to pick the drug that they want. They've actually been able to pay for the drug that they want, and then they've been told afterwards that they can't have it. To me, this is a concern because as a patient, when you walk into the pharmacy, it's not a free-for-all in the pharmacy. It's you have a prescription and then that prescription is fulfilled. When we're going at these online prescribers, and it's not just limited to pharmacy where the concerns are, but obviously some of the research or investigation has been around pharmacy. And it means that when you go online, in all circumstances, there aren't enough checks in place so that the person is able to identify exactly who the patient is. Whereas when you walk into a pharmacy, I can see you face to face, I can see information about your body language, I can recognise a bit more about you. And what we know is that unfortunately some patients have put in false information in order to obtain medication.
And I'm assuming the most common must be medication that somebody feels they're reliant on, perhaps even prescription painkillers that they might be addicted to, that it might be antidepressants, it might be sleeping pills. These are very dangerous medications, aren't they?
Yes, and I think, as a healthcare professional, my first thing is to trust the patient. If a patient's telling me they need something, I don't immediately think that they're going to use that for nefarious purposes, or they want to accumulate a higher number. So some of these, unfortunately, the patients have been able to acquire a higher number of pills than I would provide if I was looking at them face to face. So overall, though, what can we do about it? Because that's really the focus of this. And the General Pharmaceutical Council regulates pharmacies, and there are other regulators for other prescribers as well. And what we're saying is there needs to be better access to patient records for all healthcare providers. If you think about the dentist at the moment, your dentist isn't necessarily able to feed back what medication they've prescribed for you to the GP. So we need better access to records across all healthcare providers. This is one key point for me. At the moment, patients have been able to opt out of letting their GP know that they have sought medication online. And to me, that shouldn't be the case. It should be, if you're going to use our service, you absolutely we have to be in a position to tell your GP that you've sought that medication.
Okay, well, that is crystal clear, Thorrun. Thank you very much. And actually, you make that point about the GP opt-out. That was one of the things that the talkTV investigation really was highlighting, that there shouldn't be a button that you can press and say, no, don't tell my GP that I'm after this. Thorrun, thank you so much.